Hi, Juliette here, and I want to talk to you today about chronic fatigue syndrome, what it is, its causes, its treatment options, and then to round things off with my take on things at the end and why I disagree from experience with the doctor's opinions. So if you find these videos helpful, then please hit the like and subscribe buttons as it helps more people to find the content, and click the bell to be notified when a new video comes out. Okay, so let me address the first question that I see related to chronic fatigue syndrome. Is it real? And the answer to that is a categorical yes. Chronic fatigue syndrome is real. I realise that for those that are fortunate enough to have never experienced it, it may be difficult to understand the severity of the condition, but it is absolutely real. So what is chronic fatigue syndrome? Well, chronic fatigue syndrome, or CFS, is also known as myalgic encephalomyelitis, or ME for short, and is often seen written as CFS-ME. For many, the two terms are interchangeable, but for now, I'm just going to stick with the term CFS for ease. So the Mayo Clinic defines CFS as extreme fatigue that lasts for at least 6 months, that can't be fully explained by an underlying medical condition, and the fatigue worsens with physical or mental activity but doesn't improve with rest. But CFS is more than just extreme fatigue, and it has a wide range of symptoms that affects people physically, mentally, and emotionally. So what are the symptoms of CFS-ME? Well, the NHS lists the most common symptoms associated with CFS to include feeling extremely tired all the time. This can impact on your ability to do day-to-day tasks. Still feeling tired after resting or sleeping, taking a long time to recover after physical activity. Problems with sleeping, such as waking up often during the night, and also problems with thinking, memory, and concentration. It also explains that some people also experience muscle and joint pain, headaches, sore throat, flu-like symptoms, feeling dizzy or sick, fast or irregular heartbeats or palpitations. And yet, most of the websites out there that explain what chronic fatigue syndrome is neglect to mention the emotional and psychological effects the condition can also have. These include mood swings, where you can feel pretty level-headed one minute to swinging into a temper the next when something that you used to be able to do defeats you. This can also end up with you in tears, feeling scared, frustrated, hopeless, helpless, and wondering what's happening to you. Feelings of shame, as others around you have to start helping you more and more, and they start to become your carer. You may notice your independence is going and you're increasingly relying on others. This can also lead to feeling guilty that others are having to take on a role that they never expected and that you feel you should be doing. Also feeling embarrassed, as brain fog and issues with speech and cognition mean that conversations can become difficult as you struggle to keep up with the flow of a conversation, forget words, and have trouble speaking fluidly and coherently. Given enough time, this can also lead to social isolation as you start to avoid the places where you'll have to engage in conversation. These are just a few of the emotional effects of CFS that are so regularly ignored when describing the condition, and I believe it reduces the understanding and empathy that people have as a result. So you can see that CFS-ME is so much more than just feeling exhausted all the time. It's a complex condition with a variety of symptoms, and even now is generally misunderstood and underestimated by many people. It's also worth saying that with CFS, many symptoms can vary. This may be hour to hour, day to day, or week to week. But one thing that many sufferers agree on is that they can't rely on the consistency in their bodies and their symptoms, which makes making plans, going to events and socializing becoming a frustrating and unpredictable part of life. So what can chronic fatigue syndrome be mistaken for? CFS-ME can be mistaken for a number of other conditions, and the CDC recognises the following as conditions that need to be ruled out and treated for before a diagnosis of CFS can occur. So that's immune disorders, including autoimmune conditions, deficiencies or imbalances such as iron imbalances or adrenal insufficiency, side effects of certain medications, connective tissue disorders, multiple sclerosis, sleep disorders such as sleep apnea, and some cancers and infectious diseases. and also active primary psychiatric disorders, which are like eating disorders, alcohol or substance use disorders. So who can diagnose CFS-ME? Well, due to the nature of CFS symptoms and the need to rule out other conditions, patients find themselves being diagnosed by their general practitioner, or GP, a rheumatologist, sleep specialist, an immunologist, or other medical specialist. Ultimately, diagnosis of CFS is one of omission. That's to say that it's what's left when everything else has been ruled out. So what's the cause of chronic fatigue syndrome? Well, the medical profession, including the CDC and the NHS, agree that there is no known cause for CFS-ME. But they do have some theories on possible triggers. These include viral infections like glandular fever, bacterial infections such as pneumonia, immune system problems, hormone imbalances, genetics, some families seem to be more susceptible, and psychological stress. So what are the treatment options and how do you treat chronic fatigue? Well, all current treatments for CFS-ME are targeted towards relieving symptoms, as it's generally considered that there is no cure. Treatment options can range from medications to help with depression, pain, blood pressure issues, and sleep issues. Then there's counselling to help with coping skills and to manage depression. There's low intensity managed or paced exercise, discovering how to balance your energy use without flaring or worsening your symptoms. Then there's complementary therapies such as massage, meditation and relaxation, and cognitive behavioural therapy or CBT. Now, the NHS describes CBT as being based on the concept that your thoughts, feelings, and physical sensations and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. It says that CBT aims to help you deal with overcoming problems in a more positive way by breaking them down into smaller parts. You're shown how to change these negative patterns to improve the way you feel. Unlike some other talking treatments, they say that CBT deals with your current problems rather than focusing on issues from your past. It looks for practical ways to improve your state of mind on a daily basis. So, my personal observations on this. Having lived with and recovered from over 2 decades of chronic illness, including chronic fatigue syndrome, I have some observations that may go against the grain. Firstly, I sometimes wonder why doctors are so quick to tell you that you can't be cured from CFS-ME, but so slow to tell you that they don't know why you've got it in the first place. If they don't know how it happened, how can they be so sure you can't heal? 10 minutes searching on the internet will show you testimony of hundreds, if not thousands of people that have healed and now live perfectly normal lives without any CFS symptoms. Now, I've seen arguments online that they're in a remission phase and it may come back. And sure, I get it. But as I see it, if I can spend the next 10, 20, 30 years of my life full of energy and enjoying myself, then I'd rather do that than spend those same years feeling tired and crappy because I gave up and never tried to improve for fear of relapse. My other observation is that over and above CBT, which didn't personally work for me, I found that self-development and doing the inner work really made the biggest difference in my life. Now, I fully agree with the NHS's explanation of why CBT should work, in that our thoughts, feelings, and physical sensations and actions are interconnected. This is just another way of explaining the mind-body connection and the power of our minds to influence the functioning of our bodies, which can go both ways if you're not careful. For this reason, I found subconscious therapy to be the best way for me to deal with the underlying causes for my illness. When we do standard talking therapy like counselling or something like CBT, we're working on the issue at a conscious level. And yet it's believed that our conscious only accounts for around 5 to 10% of the overall behaviour patterns, emotions, reactions and decisions in our day. That's to say that 90 to 95% of who we are is unconscious or subconscious. It's there we need to be doing the fundamental work if we want to see change. And maybe that's why the doctors don't believe you can heal, because they don't deal with healing your subconscious. They don't have the same experiences of watching people's transformations in the same way that a hypnotherapist or subconscious therapists can. So I hope this video has helped you get a better understanding of what chronic fatigue syndrome, or ME, is, its causes, diagnosis, and treatment options, and also a little extra hope if you are asking yourself the question, can chronic fatigue be cured? Again, if you enjoyed this video, please hit the like button and subscribe to my channel. And remember, there is hope. You can heal.